Welcome back. March is Colorectal Cancer Awareness Month. I spoke with Dr. Robert Amajoy of St. Luke's Health System on how screening can dramatically impact survival rates. So I know firsthand how important it is to get colon cancer screenings because a few years ago I actually lost my grandfather to colon cancer. So we really want to dive in and find out how often people should get screened and at what age.
2 years ago, the American Cancer Society dropped the age to 45, and the reason is because we are seeing more cancers in younger and younger patients. In fact, the incidence is about 1% increase every year. So it is 45, it's no longer 50.
Second, we want to talk about some of the innovative treatments that you have here at St. Luke's.
We do basically all of our colorectal cancer surgeries robotically. And the robot is a very important technology because, one, it reduces the amount of incisions we make. The incisions are smaller. There's improved visualization with the 3D technology and the high-definition cameras that the robot has. There's also improved dexterity. And some suggest that with improved dexterity and improved visualization, there's less blood loss during the operation. There's also less risk of wound infection, both on the incisions and also inside the abdomen. For the patients, the less incisions cosmetically looks better. They eat sooner, they have sooner bowel movements. They get back to their normal activities sooner, they recover faster. So that is a very important part of our program, and we have fantastic, talented, board-certified team members in colorectal surgery, surgical oncology, med-onc, and radiation oncology that are dedicated to taking care of these patients.
Well, and if I saw things right, this was where the camera was, and that gave you a 3D viewpoint, which probably has to be a dream as a surgeon because you can find out where there could be a polyp. Now, let's talk about polyps, right? Because that's an abnormality that if you found that, you've got to do something about it immediately.
Absolutely. So polyps are precursor lesions to cancer. People don't know about polyps. In fact, it doesn't get enough publicity. But we're not looking for cancer. We're actually looking for polyps because if you remove the polyps, you prevent cancer. Polyps are very common. Cancers are not very common, but polyps are extremely common. Up to 30% of Americans have polyps. So if you remove the polyps, your clock is reset. You don't have cancer. So that's why preventative treatment, like with colonoscopy, is the way to prevent cancer.
Well, schedule a screening today or meet with the doctor. You can find out more information at stlukeskc.org. We're back after this.